Okay, thank you. Let me get this going here. So, yeah, I'd just like to also acknowledge that some of this material was lent to me by a colleague of mine who's kind of been following this very closely, Julie Dombrowski. And so she shared some of the slides I'll be showing to you today. I have no relevant financial disclosures, and these are our learning objectives. Hopefully by the end of this talk, you'll be able to explain the meaning of U equals U in the context of HIV transmission, be able to review the relevant data from studies supporting this concept, and discuss its implication for public health messaging and individual patient counseling in the Caribbean region. So, U equals U stands for undetectable equals untransmittable, meaning if a person with HIV has an undetectable viral load, they are essentially unable to transmit HIV to another individual. There are three key studies I'm going to review, and I'm also going to talk about the evolution of the slogan U equals U and how that's come into sort of the modern day messaging, and how it's being used in public health and individual patient messaging. So the first study was a randomized trial published in 2016, the HPTN 052 study that randomized serodiscordant couples in which one partner had HIV and the other did not. All of the HIV infected partners had high CD4 counts and were randomized to either start antiretroviral therapy immediately or wait until their CD4 count dropped to below 250. And it's worth bearing in mind that this study was launched at a time when universal ART, regardless of CD4 count, was not the standard. So it was a reasonable question to ask. And the primary outcome they were looking at in this study was new infections transmitted to the HIV uninfected partner. They had over 1,700 serodiscordant couples, 97% of which were heterosexual, and they followed them over a course of several years. Over the course of the study, 39 new infections occurred in the HIV negative partners. However, only 28 of those were actually phylogenetically linked, meaning they actually came from the HIV infected partner in the study who was on ART or not. And all but one of those transmissions occurred in the patients who were randomized to not be on ART. The one transmission event that did occur in a serodiscordant couple in which the HIV positive partner was randomized to start treatment occurred before that person had achieved an undetectable viral load on ART. So in the context of this study, there were no transmissions that occurred from an HIV positive patient who was fully suppressed on antiretroviral therapy. That spurred interest in getting sort of larger cohorts and larger numbers to explore just how protective is ART against HIV transmission. The partner study was published in 2016 as well. That involved nearly 900 couples. About 38% of them were men who have sex with men. And these crucially were couples in which one partner had HIV, the other did not, and they were having sex without the use of condoms. Also, all of the HIV infected partners in this study were on ART and had achieved virologic suppression. So this was followed over several years. It included 58,000 sexual acts that did not involve a condom. And at the end of this, there were 11 new infections, but none of them were linked to the HIV positive partner on antiretroviral therapy. So there were 0 linked transmissions. And so, the rate of within couple transmission in this large observational cohort was 0. Now, of course, there's always, we always have these 95% confidence intervals around these estimates of the risk. In this particular study, the upper limit of the 95% confidence interval is 0.3 per 100 couple years, meaning that, at the very worst, okay, at the upper end of the confidence interval, you might see 0.3 transmission events in a couple that was followed for 100 years. Now, importantly, there were quite a bit of sexually transmitted infections that did occur in the individuals participating in this study, especially in the men who have sex with men. So 17% of the HIV negative and 18% of the HIV positive MSM in this study did have an STI during the course of the study. And that's relevant because we know that having an STI in people not on ART increases the risk of HIV transmission. However, despite those relatively high rates of STDs, there were no transmissions in this study. Now, if you break it down and look at sort of individual risk by sexual act, you do find that, of course, because the numbers are smaller, the upper end of the confidence interval is going to be a little bit larger. So I think the most important one perhaps to look at is receptive anal sex with ejaculation. That we know carries the highest risk of HIV transmission. So it's kind of important to think about, well, what is the upper limit of risk for that? And within this study, again, the risk was 0. There were no events. However, the upper end of your confidence interval was 2.23. So about 2.2 per 100 couple years of follow-up. And that's a bit higher than the overall 0.3 for the study. And so that did generate some concern. Well, do we really have enough numbers to feel comfortable about this U equals U in the context of receptive anal sex? So in response to that, the people who developed the partner study performed what was called Partner 2. Essentially, they continued following most of the original couples from the Partner 1 study who were MSM and recruited an additional several hundred serodiscordant couples, also MSM, and continued to follow them to see if we could get essentially more numbers and a better risk estimate. So Partner 2 was just reported at the IAS, the International AIDS Conference in July. Some results were reported, and essentially they have now 75,000 sex acts without a condom in gay serodiscordant couples in which the HIV infected partner is on ART and virologically suppressed. And out of that, they saw, again, 0 cases of HIV transmission. And of course, they had a significantly higher number of sex acts that involved receptive anal sex. And if you look at receptive anal sex with ejaculation, the highest risk behavior, again, the risk associated with that was 0. But importantly, the upper end of the 95% confidence interval has now shrunk to 0.59. So that's 0.59 per 100 couple years follow-up, which is pretty similar to, in the same range as the upper end of the confidence interval for the overall transmission seen in the original partner study. So that was relatively reassuring that we're just still not seeing infection rates, HIV transmission. And those findings from partner 1 and 2 were supported further by the Opposites Attract study, a similar observational study of men who have sex with men, serodiscordant couples in Australia, Thailand, and Brazil. They had 358 couples, 591 couple years of follow-up, nearly 17,000 condomless anal intercourse acts, zero link transmissions. No transmissions from the HIV positive partner on ART to the HIV negative partner. Again, similar to the partner 1 study, significant rates of STDs among these MSM, and yet despite that, still no transmission events. Now the confidence, upper end of the confidence interval, actually there's a little bit of a typo. It's more like 1.59 rather than 0.62. I'll correct that on the slides that go out later. So it's a higher upper end of the confidence interval only because the numbers are smaller than we had in the partner 1 and 2 studies. These are important data that clearly affect, I think, the messaging we deliver to individual patients and their partners about the risk of HIV transmission. However, it's kind of grown into more of a public campaign, and I think it's worth reviewing the timeline of that. This concept of U equals U didn't come out of nowhere. It sort of started in 2008 when, for kind of obscure legal reasons, the Swiss National AIDS Commission made a statement that if you're undetectable, you are not at risk of transmitting HIV to others. Now that garnered quite a bit of criticism at the time, but then the additional research started coming out that I've alluded to, the HPTN 052 study, in the same, that was stopped early. The same year, the Vancouver, British Columbia had the STOP campaign to try and get everyone with HIV in that city on ART for the public health interest of reducing HIV transmission. United States treatment guidelines shortly thereafter recommended ART for everyone, partially because of the potential public health benefit. Then the partner study came out or was launched that I mentioned, finding no transmissions. The U equals U campaign sort of came out in 2016 by an organization called the Prevention Access Campaign, who really tried to take this message public. The Opposites Attract study came out just last year. And also last year, a number of organizations and governmental agencies kind of signed on and endorsed this concept, including the United States Centers for Disease Control, the National Institutes of Health, several state health departments. And at this point, it's been endorsed now by over 600 medical and social organizations from 75 different countries. So it's really garnered quite a bit of momentum and support. And again, why the sort of public messaging nature of U equals U? Well, I think it's based in large part on the idea that this could dramatically reduce stigma. If the public is aware that people with HIV are really not at risk of giving it to other people as long as they're on treatment, that could potentially deliver a powerful message to the public that these are not people to be feared so much. And so hopefully it will have a big impact on stigma. Now, what are the implications of this? Well, it really is a big change in messaging because, we've always delivered the message that, really it has to be condoms. You have to use condoms to prevent HIV. It's worth pointing out, I think, that, the data suggests that being undetectable is actually, significantly more effective than condoms are, because condoms are not perfect either. And while, you know, there are always caveats, it's also important to have a clear message for patients and public health campaigns. So these are some examples. The U equals U consensus statement says people living with HIV on ART with an undetectable viral load in their blood have a negligible risk of sexual transmission of HIV. And go on to say negligible means so small or unimportant as to be not worth considering. The CDC generated a letter that went out to physicians in the United States in September of last year that includes language in part stating, this means that people who take ART daily as prescribed and achieve and maintain an undetectable viral load have effectively no risk of sexually transmitting the virus to an HIV negative partner. And there are, you know, here are some other examples of the way the U equals U risk messaging is being used by various agencies and HIV experts, state governmental agencies, public health campaigns, the medical literature, you know, things like statements like cannot transmit, effectively no risk. From a practical standpoint, the risk is zero. Can't pass it on. So these are, you know, the kind of language we're seeing being used around U equals U. Now, you know, in terms of counseling patients, I do think patients, you know, really deserve to know this. This is the science and this is the state of the art. And knowing that for an individual patient with HIV to know that they're essentially at zero risk for transmitting HIV to others can make a real difference in sort of how they feel about themselves. It can be a real sort of morale booster, I think. It can be also motivating to take ART in that same context. So some examples of messages for patients. It would be reasonable to say, I think, people with undetectable viral loads don't transmit HIV. 3 things prevent HIV transmission: viral suppression, pre-exposure prophylaxis, and condoms. For patients who have, you know, a serodiscordant partner, you might say that you and your partners need to decide the right mix of those 3. Some people might be comfortable with 1 or 2 of those, others decide to do some other combination. But 2 things to remember if you aren't using condoms every time: 1, you need to be taking your antiretrovirals regularly and be checking your viral load regularly to make sure it remains undetectable. And 2, without condoms, you are at risk for sexually transmitted diseases like syphilis, gonorrhea, chlamydia, and you need to get screened regularly and come in quickly for any symptoms. So let me just summarize with some key points of this lecture I want you to take away. There's been 1 randomized trial, 2 large observational cohorts that have shown 0 risk of HIV sexual transmission from a virologically suppressed HIV positive person to an HIV negative sexual partner. I think persons with HIV infection and their partners should be counseled regarding the implications of these findings. And the public messaging around U equals U, it does have the potential to reduce stigma around HIV infection. Now, this is all relatively new, and frankly, I'd really like to open it up for a little comments and thinking about, you know, what this might mean for the Caribbean region and what your take is on the material I've presented.
Dr. Behrens, for another interesting presentation. So we're going to throw this out first.